Good evening. It is Thursday evening, January 6, 2022. This is the Guilford Board of Education. We are meeting tonight. This is a special meeting that we called in order to hear from Dr. Freeman and discuss with Dr. Freeman COVID-19 updates as our schools have opened this past Monday, January 3rd, following the holiday break. I'm going to turn it, Dr. Freeman, right over to you.
Thank you very much, Dr. Beltracy, and thank you everyone for joining me tonight. We did want to make sure that we had an opportunity to talk about this week, to talk about the changes to protocols that we've put in place, but also to give you sort of a debrief on how the week went. I do want to start the meeting by noting, I think that you are all aware, but we did send notification out to the community tonight that tomorrow will in fact be our first snow day of the year. The timing of the storm looks like an easy call, and after the week that we've all experienced, really happy to be announcing a snow day today. I have received a number of emails from students and staff members thanking me for that decision since that notice went out at 5 o'clock. So we do hope that everybody enjoys the snow tomorrow. That being said, I want to give a little bit of update on this week that has just passed. I want to start with some of the new numbers. To set the context, I want to remind all the board members and community members watching that for the entire month of September this past year, we identified 13 positive cases of COVID in our schools. We became aware of 13 adults or students who were in the schools, contact traced those cases, the students and staff who were positive isolated, anybody who was identified as a close contact to those individuals quarantined. Again, 13 total cases in the month of September. Since December 24th to yesterday, we processed 224 positive cases of COVID, cases of which we became aware. Now, when I say processed, we processed those differently. I'll note some of those changes moving forward. But that's the scale of the difference that we're experiencing, from 13 in an entire month to 224 from December 24th, 224 from December 24th to yesterday. 189 of those were among the student population, and 35 of those were among staff members. On New Year's Eve, at 7:40 on New Year's Eve, superintendents across the state received notification from the Connecticut State Department of Ed and the Department of Public Health that we would be changing protocols as we returned to schools following the holiday break and in the midst of these increasing positive case numbers. Our team met through the day on Sunday. The COVID team met. That include Pam Nelliber, our nursing director. It included Rob Nolfo, our advising physician. It included Sonia Marino, the town health official, as well as members of our central office clerical staff and principal representatives. Later in that same day, I met with regional superintendents to talk about directions that we would be going and decisions that we would be making across districts regionally. And then into the evening on Sunday, I met with the leadership team, all of the principals and central office staff, to be sure that we had plans in place to open schools on Monday. I do want to make it clear that opening school on Monday was not a local decision. The State Department of Education still requires that schools complete 180 days of in-person schooling this year. There were some conversations across the state about whether or not schools would be given permission to hold a distance or virtual day of learning and have that count as a school day. We were not given the opportunity to do that, to have virtual learning in place. What that means is if the district decided to remain closed on Wednesday, or for this first week coming back from the holiday, or for 2 weeks coming back from the winter break, all of those days, any of those days, would need to be tacked on to the end of the school year and made up as we go into June. I am unaware of any districts along the shoreline area who made the decision to stay closed on Monday. I do know of a small number of districts. I believe there were 4 districts statewide that chose to close on Monday, but instead to make that day up later in the year. We did open Monday morning. We have been open for 4 days this week. We have been monitoring staff numbers very closely to ensure that we have staffing available to us that would allow us to open the schools safely and effectively. Across this week, as we looked at staffing levels, on Monday, we had 31 teachers. Now we had other positions that called out sick, but on Monday, there were 31 teachers who were not available to come to work. On Tuesday, that number increased to 37. Yesterday, that number increased to 44. Today, that number ticked down a little bit, coming down to 40. But 31 puts us at just below 10% of our teaching staff who were out on Monday. At 44 and 40, we're sitting at above 10% of teaching staff who are not available to be in the schools today. Not all of those absences are related to being positive. I mentioned earlier that there were 37 staff members that we know of who are positive for COVID. So of the 40 who are out today, 35 of those we know that are positive for COVID, and other people may have been out for other reasons. Student population attendance this week. On Monday, we had 511 students who were out of school. That represents about 16% of the overall student population. We know that 473 of those students were out because of illness. We don't know specifically how many of them were out for COVID-related illnesses, but their parents reported 473 of them out sick. That represents about 15% of the student population. Today, we had 427 students who were out of school. 407 of those were reported as ill. They were out sick. That represents about 13% of the student population. So again, I mentioned earlier that we know of 189 positive student cases, and 407 students were out of school today. Some of those may have been close contacts. Some of those may have been out for other reasons.
Dr. Freeman, can I ask you just one quick question?
Of course, please.
What those numbers look like in a regular year?
So they're not dramatically increased. It's a little bit high, but it is not spectacularly high. I think the best comparison I can make is recently we know that on a recent Friday, we had sent out notifications about a TikTok scare that was taking place. We know that we had concerns about suggested violence that was going to take place at schools. We had communicated with the community. We had additional police available. On that day, we had 450 students who were absent at the high school alone. That was a much more significant absentee event than what we have been experiencing this week. So elevated, but not, I wouldn't say that it is dramatically elevated. We do anticipate those numbers to keep going up. And so we're gonna continue to monitor those. I met with the leadership principal team earlier today, and I will be touching base with all the principals on Sunday evening as they are monitoring staff attendance. And then we've been checking first thing every morning to check staff attendance. It is not out of the realm of the possible to consider that there may be an announcement that goes out early in the AM in the next 2 or 3 weeks, because we find that we have a spike in absenteeism and we are not able to staff a school properly. So we'll monitor those really carefully, and we'll continue communicating around those numbers. From there, I want to shift into that communication that we received on New Year's Eve, the changing protocols around COVID-19. There are some differences in the way that we are continuing to monitor and the way that we're continuing to respond to this pandemic as it changes. The first two and the most significant ones are that schools are no longer contact tracing individual cases. The state no longer requires or expects that from schools. We will only be contact tracing specifically in Guilford in individual isolated cases where we believe that it is essential and important, and a change in the time period for isolation and quarantine. The timing for isolation and quarantine has been reduced from 10 days to 5 days. Both of those are significant changes. I want to speak about each of them just a little bit. Again, back in September, when the rate of positivity was much, much lower than it is now, when we became aware of a student who had been in school who was positive, our school nurses the building principals, and our nurse director, Pam Nelliber, would look at that student's day, and we would determine where that student had spent time, who sat near or around that student, who ate lunch at the table with that student. We would determine how many students were within a 6-foot bubble of that student for 15 minutes or more over that 24-hour period. In those cases, we would inform the parents that those students had been identified as close contacts. If those students were fully vaccinated, that was a notification only, and the parents were simply asked to monitor their students closely for symptoms. Those students could continue coming to school. If the students were not fully vaccinated, then those students would be required to quarantine and remain out of school for a 10-day period, similar to the student who was positive, him or herself, and was isolating for that same period. As the pandemic evolves, the guidance that we're receiving from national, state, and local health advisors is that this newest variation of the virus does not require, and we won't benefit from, conducting that close contacting. The numbers are going up so significantly that it will make simply logistically conducting that close contacting almost impossible to do. We simply don't have the bandwidth to be able to be looking at each case that closely as the numbers go up. Additionally, although the infection spread, or the infectivity rate is higher, the severity of this case is lower. And so the focus is shifting from contact tracing to addressing students who are symptomatic or positive. So at this point, the school nurses are responding to students who begin to exhibit symptoms or students who we know of who are positive. The change in the isolation and quarantine rate, and my understanding, similarly from national, state, and local authorities, is to focus on, and again, remember how many more students are going to fall into that positive category. It is focused on keeping the students home and out of school when they are most infectious, but allowing the students to return to school so that they are not missing as much school time as they would be as we move through these numbers. It's not the reason for the change in the number, but it also it does have an impact on our teachers' ability to balance the students who are receiving instruction at home. If we were at these numbers with all of these students at home for 10 days, I believe it would make the logistics of balancing some students in the classroom and some students at home all that much more challenging. I know that there has been a significant amount of confusion around that 5-day period and communicating that 5-day period out. Whether or not the 5-day period requires a test to return, whether or not the 5-day period applies to isolation or quarantine. My understanding at this time is that the 5-day period does not require a negative test for a student to return. So when your student is identified as positive, they must stay at home for 5 days and until their symptoms significantly improve and they are fever-free for 24 hours. At that time, they may return to school. They are required to strictly mask when they return to school. Now, we require everybody to mask at school. The entire school is still under a universal mask mandate. So students returning to school at 5 days would be required to mask anyway, but the CDC reminds us of the importance of masking after that return. A test is recommended, but a test is not required at the end of that 5-day period. Additionally, yep, I'm sorry, Moira, go ahead.
Just to clarify, because a lot of parents have asked me this. So what if they can't get their kid tested? You're saying they're positive, the clock for 5 days starts. What if families can't get a test? How are they judging that 5-day isolation for the school, you know?
If your student hasn't tested positive, then your student is likely home as symptomatic. And that has been a catch-22 for us now that we have begun experiencing test shortages again. The real reason that becomes a catch-22 is because of the offering of distance learning. So I'll shift to that topic now. The state this year has identified 4 specific conditions under which students may receive distance learning, and only under those 4 conditions. The first one is that students are identified as either positive for COVID-19 or as close contacts to somebody who was positive for COVID-19. Those are the ones that we most frequently experience. There are then 2 conditions that are identified as exceptions. Children who are living in homes with another family member who may be considered at high risk for COVID can petition the school district to receive at-home instruction so as not to place that family member at risk. Students who themselves are at high risk or who for either a special ed or other special ed condition or medical condition cannot appropriately mask can petition for an exception to receive at-home instruction. The 4th condition would be the identification of an outbreak, either at the district level or a building level. What doesn't fall into that category is symptomatic and waiting for a test. And that wasn't particularly a problem in September and October of this school year when tests were readily available. It became a much more significant problem when we experienced a shortage in tests, and it became this catch-22. My child is symptomatic. I know I can't send my child to school when they're symptomatic, but if I can't get a test, then we're not able to provide distance learning either because they're positive and they can't come back to school because we don't know for sure that they're negative. Some of the good news that we have to share tonight is that yesterday the school district received our distribution of at-home test kits, and the state has changed the requirement. Up until just this week, that test that would allow you to come back as negative, up until just this week, that test had to be a lab administered test. The state has relaxed that requirement. We can now accept at-home tests. And we received yesterday, and we distributed to schools yesterday, 566 sets of Flovex tests. Those are single-use tests, and 1,500 boxes of iHealth tests, which are a 2 administration test kit. So now when a student is identified as symptomatic and we send that student home from school, we will now be sending that student home with an at-home test kit. The parents will then be able to test their child. If the child tests positive, they know that they have to go through the 5-day isolation period, but we will immediately begin providing distance learning services. If the child tests negative and the symptoms improve, the child can return to school immediately. And so we believe that it will clear that frustration up. If a child is a close contact, then the parents can contact us and we can make a test available. Now, we only have 2,000 of these kits. We can't, if my first question was, can we open up those 2 usage kits and separate them out and turn it into 3,000? And we can't. So we've got 1,500 2-dose kits that we can send home. We've got 566 single-dose kits that we can, not dose, but test kits that we can use. Those are available to students and staff members who need a test in order to be cleared to continue coming to school or to confirm that they're positive. The town does have some kits that they've distributed, a limited number, and I believe the town may be receiving more. But for at least a short period of time, this should relieve that catch-22. Did that answer your question, or did I go off on a tangent?
No, you did, but I'm going to share with you, and it's not to make this more difficult. We have a lot to cover, but I was reading on, several various research data that's coming back that this Omicron variant is not showing up in these rapid tests for 3, 4, 5 days. And sometimes the viral load isn't even strong enough to get picked up on these home tests. So I know a lot of parents are panicking because they want that PCR because their kids are showing all the signs of having COVID, but they're getting these negative tests at home. And then the PCR is coming back positive, but 5 days into. So the question I've gotten, and this is 3 different folks that have reached out to me about this, is my tests were negative at home. Then lo and behold, 3 days later, I get their result back from the PCR and it's positive. Am I starting now? Day 1 when I get the result back, or am I backtracking backwards to when I took the it's so confusing. The parents aren't sure about what that 5-day, And I'm not asking you to have a crystal ball, but this is what's happening because these
Yeah.
home tests are not showing positivity like we experienced in the past.
It is confusing, and oftentimes it's an individual decision. But in most cases, we are identifying the clear identification of symptoms as the beginning and not the date that you received the positive test. And that determination is being made by our school nurse and our advising nurse, or the family can reach out to their pediatrician and help get guidance there as well. And I saw Dr. Balistraci nod her head. It's usually the onset of symptoms.
That's really helpful because I think there's a lot of panic about the testing piece.
And
I just want to be clear. I was nodding my head honestly about the confusion of it for a parent. And I do think contacting a pediatrician is probably a really helpful way to sort that out, because I think it's very confusing.
And again, right, we know that this is increasing the need for communication, right? Parents are needing to talk to the school nurse. They're needing to talk to Pam Nelliber. And so that, again, was one of the reasons when I talk about the shift in focus from pulling seating charts and conducting the contact tracing to having these conversations with parents and families as students are going home for the symptoms. That's exactly the shift that I was talking about. And Arnold, I see that you've got a hand raised as well.
Yep. So, I mean, to Moira's point, the flip side of the coin is that the PCR test can also test positive, a month after you've recovered from COVID. So it's kind of a catch-22, I think. But to that point, I think the rapid antigen test is good for determining whether by no means am I like a medical expert, but it's better for determining whether somebody's actually contagious. Maybe Christy can talk to this, I don't know. But is there any reason that we don't have test kits at schools? And is there any reason that the school nurses can't administer the tests or proctor the tests with a parent there, something like that? And I know budgetarily there might be reasons. I'm just asking if there's like state law reasons, state edict reasons, what have you.
I think it has to do both with logistics and capacity, but also to do with permissions, right? And so if we wanted to be conducting those tests on minors, we would need parental permission in order to be able to conduct that, right? And so, and again, in most cases, we're offering those kits to students who've been identified as symptomatic. And so you shouldn't be in school when you're symptomatic anyway. And so the idea is, my son came to school on Monday. He started showing symptoms. We called home and asked the parent to come pick him up and sent you home with the test. And then we said, so give him the test. As soon as he's feeling better and negative, he can return. And if it comes up positive, then we know he's positive when we go in that other direction. I am unaware of any districts that are doing the testing. That's not accurate. I'm not aware of any of the districts that are using these newly distributed at-home test kits in the nurse's office. There are some school districts that are participating in the statewide full district pool testing, and I believe those are done on site, and all of those students have had to receive parental permission to be able to be tested on school property.
Do we have any way of knowing that a test kit that a parent is administering to their child and they're telling the schools it's positive or negative? Do we know? Is there any way to verify that?
No, not really, right? So this is very much relying on the parents as part of the team. The Flovex test, to my understanding, is a plastic indicator. It looks very much like a pregnancy test. It doesn't identify the individual. We are very much relying on the parents, just as we have been relying on parents or would have in the Screen and Stay program, to check your students and make sure that they're not showing symptoms. This is a community response. I think that's why the state has been resistant to accepting at-home testing. It's why in the past it required a lab administered test that named the individual on the form. But I think that the just the increased scale of this required us to relax those requirements and to make parents part of the team and part of the process.
Can parents sign some sort of a affidavit or something as they send their kid back?
We haven't pulled that together yet. I think that if this had developed more slowly, that might have been a direction that we had gone. The state is not requiring that. And quite honestly, we got the tests yesterday, had them in schools by yesterday afternoon. And I think one or two of them went out the door yesterday with students who were identified late in the day, because we didn't want to lose any time. I think if it had developed more slowly, we might have put an attestation component into that. At this point, we didn't. We're just trusting the parents to do the right thing.
Got it. And you know, I obviously I'm a parent. I do not distrust parents. I want to make that clear to everyone. But there's so many pressures on parents and kids at this point, and teachers and you guys. So
no, that's absolutely right. That is absolutely part of the conversation that we had. But we moved really quickly to try to put these components in place. I did skip over some of the questions that moved me in some different directions. I did skip over the mass distribution. I do want to highlight that as well. The district also received a shipment of N95 masks. We received those on Sunday. Those were distributed out to school buildings over the afternoon on Sunday. Monday morning, when staff received to the building, there are N95 masks that are available to all of the adults working in all of the locations. These masks are only adult sized. They don't come in children's sizes. So at most school levels, they wouldn't be appropriate for students. The town also has received shipments of the N95 masks that they have been and will be distributing out to community members. We think that it is an important part to make sure that the staff members have access to those masks. We're not distributing them out to the student population because we don't have numbers that would be sustainable to distribute out to the student population. We do think it's important to make sure that we're both protecting the staff members who come into the building and they protect the students who work with those adults as well. We will continue pushing those out to adults for as long as we have those. I have sent communications out to the parent community, letting the parents know that while we are not in a situation that we can provide those enhanced masks for all, I'm encouraging parents to think about sending your child in with a better quality mask, a higher, more effective mask, or to consider double masking. We have also told the community that we are becoming more vigilant around masking. We have always been under a mask mandate this school year. There's never been a time that we weren't requiring all students to wear masks in school at all times, all people in the schools, any individual to wear a mask at all times. But I do think that as the numbers were low and human nature being what it is and people becoming tired of this pandemic, that we started to become somewhat lax around that practice. I reminded the community, I asked all parents to talk with their children about masks at home, and we reminded all of the principals who have reminded all of our teachers that we need to be vigilant, that we need to remind students to wear their masks, to wear them properly. We're being more careful around when we take mask breaks. We are reminding students, even in the lunchroom, that if you're not actively eating, you should in fact be wearing your mask. I have received some communications from parents this week who were really upset at the idea that students were supposed to wear their masks in between bites. In between bites is open to interpretation. If a child is eating a banana, we don't actually think that if you're eating a banana, 1, 2, 3, that you're going to put your mask on in between each of those bites. However, if you're going to take 5 minutes in between eating the banana and eating your apple and talk to your friends, we do want you to put the mask back on for those 5 minutes in between. And then when you take the mask off to eat the apple again, you don't have to put it on in between every apple bite. But that is the level of seriousness. We do want students to really think about wearing their masks. And you don't take it off for the whole lunch period. You take it off for the time you need to during lunch, and then you have it back on when it's not necessary to keep it off. And I think any of us who are still going out to restaurants are seeing restaurant patrons doing exactly that same. So we are encouraging parents to think about the quality of the mask that your student is wearing, and we want parents to be aware that we will be talking about it more and encouraging more vigilance around mask wearing in schools, as well as distributing those N95s. I do believe that the fire department will be distributing more N95 masks from the high school parking lot on Sunday of this coming weekend. There'll be more information going out about that in the coming days. I also wanted to mention some of other measures that we're putting back into place. We were really excited that we had recently started opening the schools up to more visitors coming into the schools. We had our mentors beginning to come back in and meet with their mentees in person. We have restricted many of those activities. We are going to be strictly limiting outside visitors into the schools. The mentors are shifting back to Zoom meetings with their mentees. We're restricting any field trips or any large groups or assemblies that happen during the school day. Clubs that can meet virtually, we have encouraged to meet virtually, and some other clubs or social after school activities that are not appropriate for a virtual platform, we have put on hiatus for a week or two as we move forward. I do want to note that we've had a number of conversations with CIAC and surrounding school districts. We will not at this time be restricting athletic opportunities, and we are not restricting the spectators who come to athletic contests. And I know that sounds like a contradiction, so I want to talk to that a little bit. I want to speak to that a little bit. One is that we are trying to make decisions where we reduce exposures and ancillary activities. We have encouraged faculty meetings and PLC meetings and any adult meetings in the school day that can take place on Zoom to take place on Zoom. We're meeting here in Zoom tonight, not in person tonight. As I said, clubs and social activities, we're asking to move to a Zoom platform or to take a break in meeting time. We're doing that to protect what we consider to be the core and essential parts of the program. And that includes both the academic classroom, but it also can include for a lot of students, the athletic opportunities that we offer. The spectators that come to those events, two pieces. They can be an essential part of that event. And as we looked at our own numbers, we noticed two things. One is we're not bringing in crowd sizes at many of our winter athletic events that are significant or would be problematic. Oftentimes, if we're not playing a home game against Madison, we're not bringing in really large crowds to our athletic events. The spaces that we use allow those crowds to space themselves very appropriately. Additionally, we have noticed that the crowds seem to be self-policing. We've noticed that the crowds are actually a little bit smaller. It is a voluntary activity. People can choose to come to an athletic event or not. They know their vaccination status. We are requiring masking. I think we have noticed that we're seeing fewer grandparents coming to the athletic events because people are making thoughtful choices for themselves. We will limit the room. We will close the room if we feel the room is getting full. And I don't mean full to fire marshal capacity. I mean, if the room begins to look like we're losing 6 foot spacing, we will shut the doors and we will stop allowing spectators into athletic events. This is the position the CIAC is taking statewide. It is what I know most of our neighbors are doing, and we will continue to keep an eye on it. I just want to note that when we talk about things like the concert performances, the theater performances, or the athletic events, which we did cancel last year, we're making every effort in this phase of the pandemic to be able to hold on to those opportunities because we do view them as essential parts of the whole student academic program. And so I know that feels like a contradiction, but that's where we are. I know that the strict 5-day masking return feels like a contradiction when we're still allowing students to take their masks off to eat. But schools are also required to provide lunch and breakfast. There's a lot of contradictions baked into what's happening here. We're doing our best to balance those conflicting mandates and finding a reasonable place to land. Dick?
There are some people are under the impression that a lot of what we're requiring is our choice and not a state mandate. That is, we're under guidelines, but we actually have flexibility. That's not my understanding, so perhaps you can clarify it.
Yeah, and most of the decisions that we're making, well, one, we're ensuring that we're meeting the mandates, and then two, we're doing everything we can to follow any suggestions or recommendations in ways that are logical, that keep kids safe, and that prioritize, again, that academic program. I guess the best example is that lunch frustration. I have had a number of parents express to me their concern about the shortened quarantine, and the CDC says your children can come back after 5 days, but only if they strictly mask for 5 days. I have had parents ask me, and this is a completely logical question, can't we just shorten the school day for a few weeks and not serve lunch or breakfast in the school? If we ran a shorter day, could we keep students fully masked throughout the entirety of that shortened day? That's an enormously logical question, but we're mandated to provide lunch and breakfast in the schools. And while that makes a lot of sense for a lot of Guilford families, if you begin to think about other communities like New Haven or Hartford, where that food program is an essential community portion, for some students, that's where they eat Monday through Friday. Breakfast and lunch are served at school, and they even take a dinner meal home with them from school. Now, that may not be the majority of families in Guilford, but that does describe some families in Guilford. And so that's probably the best example. The distance learning decision that we've made, we're following state mandates. We would likely offer more flexibility around distance learning, but the state is not allowing us to offer more than we're offering currently. The lunch is probably the best example. The CDC, the contact tracing, the state would allow us to continue contact tracing if we chose to, but they're not offering us any resources or support or capacity to be able to conduct that contact tracing. And then with the increased communication needs around the positive and the symptomatic and sending the test homes and receiving the communication from the parent that the test was negative. Remember last year we added health aides to every building. So every school nurse had a health aide working full-time in that office. We removed those positions at the end of last school year. Those positions are not in the district this year. We did not anticipate this spike in cases. And so we're doing the best we can. We're not looking to add those cases back just yet. We are told that this spike will plateau and then begin to tail off in a few weeks. But if it doesn't, we may be coming to you, as we did last year, saying that we need to start putting unbudgeted positions in the schools, which will likely run us over budget this year. Those are all things that we're looking for. But I appreciate the question. We're not making up mandates or requirements in Guilford Public Schools. We didn't make up the mask mandate. We didn't set the distance learning rules. We didn't identify the 5-day return. Again, we could choose to be stricter. We could continue to enforce the 10-day quarantine. But if we do that, we know that we're going to have more students missing in-school instruction. And we know that school is good, right? We want to keep kids in school as much as we can while balancing these competing goods. I also want to mention, I did receive a few communications today. I do want to make clear that I did speak with Ms. Chaff, the high school principal today. The high school staff is considering how to respond to the reality of midterms at the high school right now. We are very concerned about the impact that midterms will have from a stress and anxiety direction on our students. We're also concerned about students who are missing real school time and the impact that would have on their ability to take and complete the midterms. Ms. Chaff is meeting with the high school staff. They're very concerned about that. They're also concerned, however, about being able to continue to make sure that students have the opportunity to experience midterms. Our freshmen and sophomores haven't had the opportunity to experience midterms or finals yet. That is going to be a part of their college experience. I think one of the considerations that the high school faculty is looking at now is having a midterm experience, but dramatically lowering the stakes and the impact and the stress associated with it. A midterm usually has an impact on the year-long grade. It represents, I believe, something like 10% of the year-long grade in that course at the high school. I believe that the conversation is about maybe modifying the midterms, maybe shortening them, changing what they look like, but also removing that year-long component, and it might simply be an individual grade that is part of the second quarter report, but doesn't have an impact on the full year annual grade. I don't have a final response from the high school. I know that they have not communicated that out to the parents. I think some individual teachers are talking to parents about some of the options, but I believe Ms. Chaff intends to have a communication out to the entire high school population, if not tomorrow, then by Monday. But very concerned about what that looks like and what impact that will have on students. Jen?
Yeah, Jen, go.
So I think I might know the answer to this,
Mhm.
but because I'm assuming it's the timing of the quarters. But as a parent of a freshman, I know that she and her friends are having a lot of anxiety about having midterms after the holiday break. So
Yeah.
why aren't they done before the holiday break, as they would be in college, right? That would have been done before a break, and then they come back to school.
I'd have to talk to Ms. Chaff to be able to answer that more fully for you, but I think one, it simply has to do with the way the calendar falls. And I think that traditionally it has, and I'm not always sure this is a good idea, but I think traditionally at high schools it's fallen that way, thinking that students have the break to prepare or study or work on projects. I don't know that that's a healthy use of the break. I know that Mr. Cooksey has talked about needing to provide fallow time, but I'm also speculating. I'd simply need to touch base with Julia before being able to give a more concrete answer on that one.
I think we certainly know, which is not at all an answer or a justification, that it's been that way for a very long time, I think. Interesting. Dr. Freeman, I had a question on the subject, I think, of flexibility, which it sounds like you're addressing in terms of Julia Chaff's considerations. Are we able to be flexible around absences for kids who are going through any kind of extensive quarantine or isolation? I mean, I understand, right, that remote days, if a child is positive, are then days, et cetera. Have we run into a need to think about absentee policy or flexibility around that, or has that not been an issue because we're able to provide remote when a child is positive or exposed?
Yeah, remote days are counted as present virtually.
Right.
We actually have attendance codes for present physically, present virtually, absent. But I think it has created an issue around that catch-22 we talked about before when you were waiting for test results to come in. And so, yes, what we have been flexible around is the way that we address absenteeism. The state requires us to count any day of absence, even if it is excused by a parent. And the state, for reporting purposes, requires us to identify any student who has missed more than 18 days of school as chronically absent. And then your rate of chronic absenteeism then has an impact on your DPI, your district performance index, the way that the state rates and ranks schools. We would, when we saw students who were approaching 9 days of absenteeism, we would write letters, we would reach out, we would begin working with those families in a way that we often hoped was supportive, but sometimes was viewed by families as punitive. We're being much more cautious about the way that we approach those benchmarks. And we recognize last year and this year that there's a lot of things going on, and chronic absenteeism this year is not the same as it would have been 2 years ago. The way that we address it and talk to a family and try to support it has to be different as well. Again, I'm not sure if that answers the question. We're still required to make those counts and report those things, but we are, again, trying to lower the stakes and not make it feel like we're being punitive for families who are experiencing challenges and students miss school because of it. The high school is also talking about ways to extend time and opportunity around things like makeup time. If there are students that have missed days and then need to come in and take the midterms, I know I'm jumping back a topic. We want to make sure they have the time they need to re-enter, resettle, and feel ready for that midterm before we ask them to take it, even with the lowered stakes that we were talking about. And that same kind of approach, I believe, continues to apply to other assignments all around the school system.
Excellent. Thank you. Go ahead, Moira.
I was just going to add, I'm glad to hear that they're still kind of working through this, because I got a lot of feedback about midterms and kids are stressing out the minute they know they've got to be home for 5 days. They're like, I'm going to fail my midterms. And then that stress and the stress, it's like a snowball effect. But on top of that, one of the questions I know one of my daughter's teachers today said, I might make the midterm just fit within a normal class time frame. So if you guys aren't here and you miss it, don't worry. You'll take it when you get back in a normal class time, because a lot of kids are like, oh, these are special days and they're long, testing periods. And so I think it's just really, like you said, I'm glad that there'll be another communication going out, because I think there was an initial communication grade level wise that, basically said midterms are mandatory. And I think it pushed a lot of buttons for kids and parents. So I just wanted to say, I'm glad to hear that it's still being worked through.
Yep.
Like everything we'd learned with this pandemic, we go day by day and sort it out. But if that communication can go out to families and clarifying that would be super helpful.
Yep, as I said, all of those concerns are being considered and weighed in the communication. Again, if not tomorrow, I think Monday at the latest. And that's exactly right, Marie. You explained better than I did what I meant by changing the format or the structure of the midterm. It doesn't have to be this extended, longer than normal. And then if you miss that, you've got to come in after school or on a Saturday to make that up, right? Trying to simulate the experience of midterms for some students who haven't had any yet, but doing it in a way that is not stressful, doesn't create anxiety, and just lowers the stakes and the impact that it will have. John, did you have a question too?
I did. Dr. Freeman, you mentioned 4 criteria to allow for distance learning. Some of those were short-term based, some of those were long-term based, right?
Yes.
I'm wondering, are those criteria, are they state driven, or are they?
Yes.
Okay, so they're state driven. Is there any consideration from the state? I mean, we've heard from a lot of parents, obviously, being very vocal about changes that have been made and the 5-day mask, 5-day quarantine rule. Is there any consideration being made for those very vocal parents who understandably, would prefer their kids being in remote learning? I understand, we're not talking about a huge percentage potentially, but what defines close contact these days? What defines, a family member that might be at high risk? I'm wondering if there's, are we having families that, potentially are using this to keep their kids home? Or is there any way to extend that, to a broader, population to allow for remote learning of some of these children?
My understanding at this time is no, that the state is not entertaining the opportunity essentially of providing a distance option at request, which remember is what we provided all year last year. So even though we reopened last year, we allowed a distance learning option for any parent who requested it. And the numbers fluctuated, but we remained around 8 or 9% for much of the year and tailed down near the end of the year. There are clear criteria for those 2 individual student exceptions, the one based on a family member who lives in the home who could be high risk, or a student who for either medical or for educational reasons needs that exception. In district, if a parent wanted to make those appeals, Jason Scanziano's office would receive that request and would take them through the protocols and would help make that determination. There was a lot of conversation about it. There was a lot of conversation over the vacation week about whether or not schools would be given permission to stay closed for a week or stay closed for 2 weeks and offer distance learning broadly. No, my understanding right now is that there is no appetite for that, and the State Department of Education or in the governor's office, and I don't hear the Department of Public Health advocating for that either. Again, I think Moira just said it, everything changes. The communication last night that we released to the community, I don't think it went out until about 9 o'clock at night, because we didn't think we had it right until about 8:30. And then this morning, before 9:30 this morning, we had to send out a correction because, again, CDC had clarified one of the definitions in that, and it was different than what we thought we had understood from CDC before that clarification. And so it's all moving. Right now, the answer, I think, is no. I don't know if it'll still be that way if school districts around the state start finding themselves unable to open, or if student attendance rates start dropping significantly lower than the numbers, like the numbers I shared with you earlier.
And what does distance learning look like these days? I know, back when we had, we had our students, like you said, 8% or so. What does it look like now? And is there any idea of what percentage are distance learning on the longer term basis, not the short term symptomatic or close contact?
We have, I think we may have 0 students who are in a distance learning model long term. I don't know if we have anybody who has taken advantage of the 2 individual exceptions. All of the students who have participated in distance learning so far this year have only done so while they were home. And so far to date, that would have been in a 10-day quarantine. Now we'll be talking about students who would be doing that in a 5-day quarantine or isolation. It is not the same as in-school learning. The state defines distance learning as a student being engaged in either real-time or asynchronous school activities that amount to at least half of the regular school day. So the way that we are conducting that here in Guilford is through a combination of live stream opportunities or individual work that students would complete at home. And so our school day in Guilford is 6 hours and 15 minutes long. For students who are home in those 5-day quarantines, they might be joining portions of classes in real time through a Zoom link like this one, or we might be using Google Hangout at the classroom level, but they join portions of the real-time classroom through a link like this, and they then may have activities that they're completing at home while students would be completing other activities that don't translate well through a Zoom link. And it would amount to at least 3 hours, 7.5 minutes of that contact time. Now, for many students, especially as you get into the upper grades where those students are interacting with multiple teachers, it could actually end up being much, much more than that. But that is the state requirement, and that is what our teachers know that they are targeting. And again, I think that is one of the reasons that the state isn't weighing the opportunity to allow distance learning as a choice, because what we learned last year is that it worked really well as a stopgap, but it's simply not the same experience and not the same value as in-person learning. So I know everybody's nervous right now. I know that reopening these schools this Monday has raised anxiety levels and concerns, but we also know that in-person school is really valuable. And so the state is still making decisions focused on that priority. And we're following those decisions as best we can. I did want to add one more piece, if I may, and I may be taking a bit of a personal privilege, but I do think that this is worth naming. Over these last 2 years, I've talked quite a bit about the grace that has been extended from this community to the school system and the employees in the school system, and particularly to the teachers, as they're struggling to do just what I was describing, right? So when a teacher finds out Monday morning that a child in her class is now positive and is going to be home today, that teacher figures out on her feet how to turn on that Zoom link and get that child into the class and have that child experience as much of that school day as she can for those next 5 days. I know that we're making decisions that are scaring people, and I know that we're making decisions that are disappointing people. We're balancing these competing goods, and we're making the decisions that are leaving people frustrated. And I know that everybody is weary, and I know that everybody is exhausted. But I really do need to ask the community to try to be patient and to dig deep and to find that grace and to continue to extend that grace to the teachers specifically, but also to the custodians and the bus drivers and the lunch servers who are continuing to support your kids in school as we go through this. And I want to share just one anecdote. There was an event scheduled for tomorrow at one of our schools. Now, this event would have ended up being canceled anyway because of the snow day that we announced. But there was an event that was scheduled for tomorrow in one of our schools. The teachers who were responsible for that event sent a notice out to the parents who were involved in that event, letting them know that because of the impacts of the pandemic, the people who needed to be present at that event wouldn't be there on Friday, and that the event was going to be canceled. Now, the impact of the pandemic and the reason that those important individuals couldn't be at the event is because they themselves are sick. They simply couldn't be at that event. Those teachers who sent that communication received a communication back from a parent, a Guilford resident with children in our school system, telling those adults, those teachers, that they were disgusting, that they should be ashamed of themselves as human beings, but particularly as Americans, for continuing to make these poor decisions in the face of this situation. That's just one situation. That is one incident, and it was one person. And I know that the general population, the vast majority of parents in Guilford, absolutely appreciate what the teachers are doing for them. But as everybody gets more weary and as everybody gets more exhausted, that story is not the outlying exception that it was 2 years ago. Communications like that are happening more frequently. I know we're frustrated, but I ask everybody in the community to remember that we are all experiencing this pandemic as individuals and as people too. All of your teachers are going through this pandemic just as you are. Many of our teachers are becoming sick because of this pandemic, just as you are. And most of our teachers have kids, some of who go to Guilford schools and some of who go to other schools, and they're worried and nervous too. And everybody is doing the absolute best they can to make decisions in really imperfect circumstances. And I just want to ask the community to please remember how hard everybody's working. Remember that everybody has the best interests of your child at heart. And when you need to vent your frustration, please find another direction to vent it, but not at the teachers who are in class with your kids every day. They just deserve better. And again, it's probably a personal privilege. I hope that the board is okay with me sharing that. But as I talk about this changing pandemic, I hope that that's not part that changes. This community has been enormously supportive of the teachers here in the schools. And I hope that's not part of what's changing as we continue to move through this experience together. I think that's everything that I had to update the board on, but I'm certainly sure that there's other questions on topics that I either forgot to raise or that I hadn't planned on raising, but I'm sure I can speak to tonight.
So thank you. Dr. Freeman, I actually very much appreciate that comment. As you know, I am aware of some of these emails as well that have come in. It is extraordinarily disappointing that some of our staff are receiving this kind of input. And so I wholeheartedly support your plea for civil discourse, patience, understanding, and empathy for everyone involved. Are there other questions that board members have, other concerns, topics around these COVID-19 protocols?
No,
Christy, go ahead.
Yeah, thank you. I just wanted to, share like to everyone, there's been a lot going on. There's so many questions, but, in particular, Moira is concerned about the at times questionable accuracy of the rapid tests. I think that the fact that you're clearly tying the symptoms to that as, a negative rapid isn't enough. If you're still symptomatic, continue to monitor, stay home. So I hope that for a lot of people just eliminates that one variable of what if it's negative, but you still seem sick. Like, I'm glad that the schools are enforcing that. my only, not to make it personal and about my children, but when it comes to the athletics, I appreciate the importance of it, but there are parents in the community whose children don't participate in sports, but do participate in clubs. So I just hope that the importance of that for a social opportunity for other children is not diminished or minimized. I hope that this is just, I understand the need right now, but I do hope that it's a return to normal pretty soon.
We hope as soon as possible, but I appreciate the comment. It's important to hear. Thank you.
Go ahead, Moira.
Just a really quick thing, and Paul, I align with Katie and what you said, Dr. Freeman, sorry, that, our teachers are doing their very best, and to please any administrators to give them grace and to give them the opportunity, the benefit of the doubt. I'd also want to pile in there the nurses, the school
Absolutely.
nursing staff. I've been in contact with a few just to see how they're doing, and they're keeping their chins up. They answer the phone with positive attitude, but they are, as one said, chasing their tails every day, and they're, doing their very best. So I just hope that the community also gives them that same grace, because they're fielding a lot of these medical questions and doing their very best. I had one school nurse, I said, just walk me through it for 5 minutes so I can explain it to 5 other families. And she did, and it was amazing, and it was concise. But just to throw that out there, just to remind folks too, to give them a bit of patience as well.
I really appreciate that. Thank you for adding that. We've got people who have been working 7 days a week in evenings for a long time. School nurses are on that list. School principals are on that list. Pam Nelliber, Terry Fiandella, Lori Hahn are all on that list. Thank you for making sure that they get named here tonight as well.
Other questions or comments from board members?
The only other thing that I'd like, if I could just add, I just want
please,
to,
go ahead.
I really want to make sure that we thank here the town and First Selectman Hoey, and really in particular, Lieutenant Mike Shove of the Guilford Fire Department, working with him to get the masks picked up and delivered, the tests picked up and delivered. We've been a little bit sort of tangentially involved in the distribution of test kits and masks that are going out to the community at large. I just really want to appreciate all the efforts of the town and the town agencies. Again, scrambling really quickly over about 48 hours that included one national holiday and one weekend a day. And they were amazing and supportive, and we appreciate all of their efforts.
Excellent. Thank you. So Dr. Freeman, I want to thank you. You did a lot of talking tonight. I thought the email that went out last night was really detailed. I think it answered a lot of questions that people had, and I one, appreciate that, and two, we just recognize, as Moira noted, that there are times where communications literally have to change on a dime or overnight as more information comes in. I want to perhaps state the obvious that the Board of Ed is meeting tonight on Zoom. We'll be meeting next Monday for our regular meeting on Zoom. We are doing this in part in support of school staff, trying to prevent them having to work extra to provide us space to be in, to give administrators who often come to these meetings and really stay involved one less in-person contact, and also because we have wonderfully had a significant audience at Board of Ed meetings recently, and we do want to make sure that we are not creating a circumstance in which we're gathering too many people in one space during a surge. We are going to make these decisions about how long we stay remote, really based on where we're at. I will say for myself, I much prefer to be in person. I prefer to give access to the public to us in person, but at the moment, this seems the best choice. So I encourage the community next Monday. We will be on Zoom. There will be a link. There will be a a public comment period, as we always do, and there will be opportunities, as always, to reach out to us via email. Unless I'm going to give one more opportunity for any comments or questions on COVID protocol, and then we can end the meeting if none exists.
Probably should have started with Happy New Year.
Yeah, that would have been a nice way. I'll own missing that one for sure.
Oh, I meant me. I meant me.
Oh, okay. All right. So for any of the public who is watching live or checks this out at a later time, thank you for watching. We will continue to try to provide up to date information on any kind of change in protocol, and continue to appreciate the administrators and the staff of Guilford Public School, who are constantly balancing, as noted tonight, state rules, CDC rules, the health of our children, the need to provide the best education we can, balancing all of that at once. So may I ask for a motion to adjourn the meeting? Moira, thank you. A second. Kristen, all in favor? Aye.
Aye.
All right. Good night, everybody. Thank you very much. We will see you next Monday evening.
Thanks, everyone. Enjoy the snow day.